Good afternoon, everyone. Thank you for registering for How to Thrive with Oncology Rehabilitation. I am Monica Escobar, the Program Manager at SHARE. Before the presentation begins, I would like to tell you a bit about SHARE. SHARE is a non-for-profit organization that for the last 40 years has been helping people through breast and ovarian cancer, offering the support of those who have been there. SHARE offers many services, including a helpline, telephone and in-person support groups, and educational programs. All services are free of charge to participants. For more information, visit our website, sharecancersupport.org. All participants will be muted during the presentation. When the presenter finishes speaking, we will open up for questions and answers. You're welcome to submit questions through the question area in the control panel on your screen. When asking questions, please remember, the presenter is unable to give specific medical advice, so please keep your questions general in nature. This webinar is being recorded and will be available on the SHARE website. Now I would like to introduce our presenter for today, Dr. Jonas Sokolof. He leads the new division of Oncological Rehabilitation at NYU Langone. He received his doctorate of osteopathic medicine degree from New York College of Osteopathic Medicine and completed his residency in physical medicine in rehabilitation at Harvard Medical School. Before joining NYU Langone in 2018, he spent 10 years as an attending physician at Memorial Sloan Kettering Cancer Center. Welcome, Dr. Sokolof.
Thank you very much. Hopefully everyone can hear me.
We can all hear you.
Yeah, I do hear a little bit of an echo.
I'm going to mute myself and the echo should go away.
Okay, excellent. Just let me know if there's any problems out there in the universe of people hearing me. Okay, thank you very much for that introduction. What I'd like to do today is kind of speak about an area that's, of course, near and dear to my heart, and that's the enhancement in optimal functioning of cancer patients and survivors, and really helping people thrive, at the time of diagnosis of cancer, all the way through treatment, and even after cancer treatment is ended, and even well after, several years or months later. So I'd like to provide a brief overview of some of the nutritional concepts that I have come to adhere to in my practice and educate my patients on. I'd like to kind of provide you with a brief overview of what the field of oncological rehabilitation really entails, provide some specific examples of some cancer-fighting foods. It's things you can actually start to implement in your daily lives. Describe and explain the recommended guidelines for physical activity or exercise for cancer prevention and survival. This is an area that I'm very much involved in through the American College of Sports Medicine. I sit on a roundtable on exercise and cancer, and we are in the process of updating the actual guidelines for physical activity and cancer, and these should be available within the next 1 to 2 months. And then, of course, I would like to provide some resources for further exploration. So we know that cancer survivors, unfortunately, have to cope with long-term effects of treatment, as well as the psychological concerns of fear of recurrence. So we know that even after treatment has ended, there are oftentimes, not always, can be issues that affect quality of life, and that's where we really shine as rehabilitation professionals, and that's really where we have a role to help in the care of these patients. 94% of primary care doctors, unfortunately, that are not really aware of these effects, these long-term effects, and therefore they're not really equipped to sort of handle them in their practices. So that's where physiatrists or physical medicine rehabilitation specialists really have a role in the care of these individuals. It's becoming very increasingly important as as the treatments for the disease evolve and become better, and people are living longer and longer with the disease, we may not be getting closer to achieving a cure in many cases. In some cancers, we have gotten better at cure. There have been advances. In other forms of cancer, we've gotten made extreme gains in improving or extending life, longevity. But with that, we see also long-term effects or physical impairment that may result from the disease itself or from their treatments. So it's becoming very important that the medical community become more and more aware of these unique issues that cancer survivors encounter. Some of the unique issues that we deal with, specific conditions that we see in an oncological rehabilitation practice, would be probably most commonly cancer-related fatigue, cancer-related cognitive impairment, or memory issues, or problems with cognition. Head and neck cancer rehabilitation. There's a great majority of my practice now at NYU are head and neck cancer survivors. A lot of unique issues that affect this population. Post-mastectomy pain syndrome in our breast cancer survivors. Aromatase inhibitor-induced musculoskeletal disorders. Various nuances that we encounter with lymphedema in the breast cancer population, but also in the GYN cancer population and the prostate population, or lower extremity edema, and certainly chemotherapy neuropathy. So these are the most common. This is not an all-encompassing list of conditions, but these are some of the most common cancer-specific issues that we encounter in an oncological rehab practice. Myself being also board certified in sports medicine, in addition to physical medicine and rehabilitation, I'm subspecialty trained and board certified in sports medicine. I have a keen interest in musculoskeletal disorders, or non-surgical orthopedic related issues in the cancer population, and we do encounter this quite a bit, unfortunately. Probably one of the reasons for this being that we do see a prolonged period of immobilization in the cancer population as folks are diagnosed, may not be feeling well, they go through their treatments and are not as active as they once were. So prolonged periods of immobilization. We can see direct toxicities many times to the musculoskeletal system from drugs, radiation, or surgery. We see an overall just lack of or deprivation of physical activity or exercise. The mindset over the past, 20, 30 years or so has been sort of, well, you have cancer, you're undergoing chemotherapy, you should take it easy, you should rest, don't overexert yourself. And we're looking really to change that mindset. And also, we also see altered biomechanics or altered movement patterns, for example, after surgery or after radiation. And that can oftentimes lead to musculoskeletal issues. Now, the field of physical medicine and rehabilitation was sort of best described by the American Academy of Physical Medicine and Rehab. If you go to the AAPMR, or American Academy of Physical Medicine and Rehab website, you'll actually see the definition for the field. And I'll just read it as follows: is rehabilitation physicians, what we do is that we take the time needed to accurately pinpoint the source of an ailment. We then design a treatment plan that can be carried out by the patients themselves with the help of the rehabilitation physician's medical team. By providing an appropriate treatment plan, rehabilitation physicians help patients stay as active as possible at any age. Their broad medical expertise allows them to treat disabling conditions throughout a person's lifetime. Now, there's a lot of overlap in our field. So we see you not only have to know your internal medicine, for example, in our field, but you also have to know a bit about rheumatology, orthopedics, neurology. So there's a lot of sort of overlap. It's a multidisciplinary field. You have to know quite a few different fields in order to help maximize the function. And my specific area of focus has been oncological rehabilitation, or cancer rehabilitation. I learned very early on, as I previously mentioned, that I have a background in sports medicine, but I learned early on that treating weekend warriors and athletes was fun, but just didn't provide me with the type of meaning that I was really looking for in my career. And I almost sort of stumbled upon the field of cancer rehabilitation over 10 years ago after completing my fellowship in sports medicine. Ended up joining faculty at Memorial Sloan Kettering, as Monica mentioned, because it just felt to me more meaningful to help in this population really make a meaningful difference in the lives of cancer survivors and help, enhance quality of life. So what we do in cancer rehab is we are essentially a subspecialty of rehabilitation medicine that's concerned with restoring the highest possible function and quality of life to cancer patients or survivors. We specialize in the evaluation of neuromuscular, musculoskeletal, and the functional complications of cancer that could be either directly related to the cancer itself or from the various treatments that patients undergo: surgery, immunotherapy, chemotherapy, radiation. And we have a role to play throughout the entire cancer continuum, meaning that we are able to get involved and help from the time of diagnosis all the way through treatment to remission, cure, or, when indicated, even in the palliative phase of care. There's a role for rehab throughout the entire continuum of cancer. I like to describe what I do many times to my patients is that I'm sort of like the conductor of an orchestra, or better yet, the Tom Brady, the quarterback of the team, and I help lead a team of professionals, consisting of physical therapists, occupational therapists, speech language pathologists, lymphedema therapists, pelvic floor therapists, prosthetists, and orthotists. The other folks that make up the team in our group would be, we also work with nutritionists, health coaches have a role to play, nurses, psychologists, social workers, integrative medicine specialists. So we are, collaborative type of specialty, and we rely on the help of many different individuals and communicate, on a daily basis with these professionals to help enhance function. I really love this quote by Thomas Edison, who really had the foresight many, many, many years ago when he said, "The doctor of the future will give no medication, but will interest his patients in the care of the human frame, diet, and in the cause and prevention of disease." So an area of interest of mine that has evolved tremendously throughout the years since I started practicing oncological rehabilitation has been a discipline that is referred to as lifestyle medicine. So what we do in lifestyle medicine is we help to intervene in the patient's lifestyle to help them adopt more healthy lifestyle habits to help overall longevity and improved level of function. So the pillars of a healthy lifestyle would be, I would say, first and foremost, what you put into your body, what you're actually fueling your body with, right? The second most important one would be exercise. So I'm going to focus on diet and exercise today in my discussion of lifestyle medicine as it relates to the rehabilitation of cancer survivors. But another component of a healthy lifestyle would be effective stress management or stress reduction strategies. Abandonment, of course, of unhealthy habits such as smoking, tobacco use, drugs and alcohol, etc. And then, of course, social support or connectedness, having sort of a sense of purpose or a sense of belonging to something sort of bigger than yourself. And of course, social interaction and connection, or love, if you will. It is recognized by the World Health Organization that a third of the most common cancers actually can be preventable through a nutritious diet, maintaining a healthy weight, and regular physical activity. There are so many epidemiological studies showing the benefits of a healthy lifestyle in cancer survivors, also helping them live longer, healthier lives even after a cancer diagnosis. A healthy lifestyle can help cancer survivors tolerate their treatments better and help prevent cancer from recurring. There are various guidelines that are set forth by the American Cancer Society on nutrition and physical activity, as well as the American College of Sports Medicine that I'm actually actively involved with, the ACSM. despite all the scientific evidence that we have that supports a healthy lifestyle, and mainly what we're referring to here is exercise, certainly physical activity being one of the most robust aspects of lifestyle that we know can help enhance survival, but also nutrition. Despite all this wonderful data that we have, survivors do not typically improve their lifestyle. So somehow the message is not really getting out there, right? So we know that cancer survivors, patients, they're not hearing this message, that they can actually take a proactive role in their own ability to thrive through the diagnosis by just, altering their lifestyle. One example that I like to use regarding lifestyle that I really like a lot is this concept of the blue zones. I'm not sure of how many of you are familiar with Dan Buettner's work on the blue zones. He wrote a book called The Blue Zones. It was first an article that was featured in National Geographic over 10 years ago. He led a very comprehensive study consisting of epidemiologists, demographers, statisticians, amongst other professionals. What they did was they searched around the globe for areas around the world that had the highest concentration of centenarians, so people living to 100 or greater. And they really looked at this and analyzed a lot of different factors, and they kind of came up with identified common variables that seem to recur in these populations. But first, the 5 blue zones that were identified were Sardinia, Italy, a small island in the Aegean Sea off of part of Greece, the Icaria, Greece, an island in Japan, Okinawa, Japan, and then the Nicoyan Peninsula of Costa Rica. And the common variables that they identified that could be, you can't say cause and effect with this type of data, but could suggest why these areas have the highest concentration of people living to 100 are that their levels of physical activity, they move naturally. So physical activity seems to be, the 5th one I think mentioned is actually in the United States, Loma Linda, California. So exercise, the physical activity is built into their normal routine. A lot of these populations are agrarian societies where they're out in the fields or they're herding sheep. They're constantly moving. It's not planned, exercise. They're not going to gyms necessarily or necessarily playing sports. It's just physical activity is just part of their normal routine. They walk everywhere as opposed to taking cars, etc. Their diet tends to be mostly a plant-based diet. Not saying that they're vegan or even vegetarian, but mostly what they're eating are whole plant-based foods. Okay, they're not eating a lot of processed foods, and they're actually not eating a lot of animal-based foods because those types of foods are more expensive and require more resources to sort of to raise and to consume. They have all of these areas have strong social connections and a sort of sense of purpose or sense of meaning. Belief systems that promote promote overall wellness and well-being. So blue zones, I would definitely highly recommend that you check that out and learn some of these concepts. Again, there are books, there's a website, the blue zones. Very fascinating. Now, getting back to lifestyle medicine and how I'd like to incorporate this into the rehabilitation, into oncological rehabilitation, is what we do is we use lifestyle interventions actually as a treatment and to manage disease and actually to manage functional impairment. We apply medical, behavioral, motivational, environmental principles to the management of lifestyle-related health problems. We provide guidelines and recommendations about physical activity, diet, nutrition, stress management, smoking cessation, and other modalities related to lifestyle decisions. We then prescribe the lifestyle changes as the treatment for the underlying cause of chronic illnesses resulting in physical impairments. We could also provide our patients with coaching along the way to improve their personal lifestyle choices regarding weight, physical activity, exercise, nutrition, smoking, stress management, and depression. So here you see on this slide, these are all the tools that we have in our box as lifestyle medicine practitioners. We actually use nutrition, physical activity, stress management, emotional wellness techniques, sleep optimization, smoking cessation strategies or toxic habit reduction strategies, avoiding risky substance use, and then an emphasis on behavioral interventions, social relationships. So getting back to nutrition or food, to me, I think food is probably the most important aspect of our health, the most important factor that contributes to our ability to live long, healthier lives. But one thing that we must realize that food nutrition involves integrated effects of countless food constituents. That it's not just one isolated food compared to another. It involves an infinitely complex mechanism to produce comprehensive health, and it's supported by exercise, water, stress reduction. It's greater than the sum of its parts. It's a biological symphony, so to speak. It's certainly one of the most important aspects of lifestyle for our overall health. Very simply, how I try to guide my patients on how to eat. There's a book that was written by Michael Pollan, Food Rules. Michael Pollan is a journalist in New York Times, and I think he's won a Pulitzer Prize along the way. But journalist who's written extensively about healthy diets and the food crisis that we have in the world, and he coined this term. And basically, in a nutshell, how to eat in the most health-promoting ways. Eat food, so meaning eat real food, so nothing that your great-great-grandmother wouldn't recognize as food. So eat whole food, nothing processed, nothing that comes out of a box or bag. Eat real food, not too much. So make sure you're staying within caloric, guidelines for healthy, adults. And then mostly what you eat low to the ground or lower on the food chain, eat mostly plants. If you follow these three principles, you will be in much better shape than compared to what we call the SAD diet, or the standard American diet, which of course is eating a lot of processed foods, overconsumption and overindulgence, and of course eating a lot of animal-based foods, which are now widely available, especially like in fast foods, McDonald's, and so forth. We do have some evidence that suggests that animal products being devoid of fiber, containing carcinogenic compounds such as heterocyclic amines and polyaromatic hydrocarbons, when they're cooked, may contribute to, well, there is a link associated with various cancers, specifically colorectal cancer. There's some evidence suggesting that high animal protein consumption can help drive cancer growth. High fat content of animal food leading to higher obesity rates, and obesity unfortunately has been tied to 12 different types of cancers. And we do know that animal consumption does increase a growth factor known as insulin growth factor type 1, and that can also drive cancer growth. However, plant-based diets, which enhance health and prevent and help or cure a broad range of diseases, do not have those adverse effects. So you don't get heterocyclic amines from green beans when you cook them, for example. They're high in fiber, and fibers can help get rid of a lot of excess hormones and other toxicants in the body that may drive cancer growth. So when we talk about whole food plant-based, we're talking about whole, unprocessed grains, vegetables, fruits, legumes, and nuts. Again, plant-based diets are rich, they're high in fiber. Fiber greatly speeds the passage of food through the colon. This effectively removes carcinogens. It actually can change the type of bacteria in our guts, and there are therefore reduced carcinogen production when we have unhealthy gut bacteria. So for example, when we're eating a diet that's low in fiber, we're depriving the good healthy gut microflora from its food, which they thrive on plants and fiber. When we kind of replace our diets with more animal-based foods, we get actually overgrowth of the more harmful bacteria, and we see these bacteria as they start to break down secondary bile acids. We see carcinogens form within the colon lining. And it could be one mechanism, not saying it's the sole cause, but it could be one mechanism that helps drive cancer growth. Plant-based foods are also naturally low in fat, and they're rich in antioxidants compared to animal-based products. So when I try to educate my patients on how to eat for cancer survival, there's basically two main factors that I'd like to educate them on. Is one, eating for a healthy immune system, and two, eating to minimize inflammation. Right? We want to jumpstart the body's ability to help fight off cancer cells, and we also want to help minimize inflammation. Inflammation playing a role in cancer growth. So we have a type of immune cell in our body called natural killer cells, or NK cells, that actually can help fight cancer. So we want to help stimulate these cells through actually diet. So as far as inflammation is concerned, some scientists and physicians consider inflammation to be, one of the main factors that drive chronic disease in general, and particularly cancer. We know that you can alter the level of inflammation in your body by what you put into your body. It makes sense, right? Essentially you are what you eat. You wouldn't put, diesel fuel into your car that, ran on unleaded gasoline, right? Same thing. You shouldn't put food in your body that's, not really meant for your body to consume. You want to minimize inflammation. What are the foods that minimize inflammation? Well, you can see the pictures on the slide. Anything processed, anything that's not real or whole food based, obviously processed sugar and processed grains. But unfortunately, also high fatty, red meats can also promote inflammation as well. Trans fats, certainly, and saturated fats, again, that we see in animal foods. What are some foods that are anti-inflammatory? Well, whole plant-based foods are anti-inflammatory. We have cruciferous vegetables amongst the highest, most potent anti-cancer foods on the planet, such as broccoli, cauliflower, Brussels sprouts, bok choy, kale, and Chinese cabbage. A lot of these vegetables contain a compound called sulforaphane and indole-3 carbanols, which are very potent anti-tumor agents. Another anti-inflammatory food would be dark berries, because dark berries contain allergic acid and polyphenols. You find these in any berries, such as blueberries, strawberries, raspberries, blackberries, and pomegranates and currants. Another example would be the alliaceous vegetables that are rich in organosulfur. They counteract these nitrosamines that are formed in the gut by the bad bacteria. And you would find the organosulfur compounds in garlic, onions, and leeks. Another example would be the carotenoids. They stimulate the natural killer cells, the body's ability to fight off cancer. And they also prevent inflammation. And then you find these in your yellow and your orange vegetables, such as carrots, your yams, and also your red fruits and vegetables, your tomatoes. And of course, we have our dark green leafy vegetables that are high in potassium, calcium, and magnesium. You find these in spinach, collards, chard, lettuces, and mustard greens. Green leafy vegetables also have high iron content as well. Now moving on to physical activity. We're going to talk about physical activity in a little bit, but I just want to emphasize that, this isn't Dr. Jonas Sokolof's, idea on how to, eat for cancer survival. This is all supported through research, and so don't really necessarily take my word for it. There's an organization called the American Institute for Cancer Research, and what the AICR does is every 10 years, through their team of scientists, epidemiologists, physicians, statisticians, very, very, very smart people. What they do is they comb through all the literature that's available on nutrition and physical activity, and they actually also look at environmental exposure as well. And they look at all the data, all the research that has been done over the past 10 years on these factors and how they relate to cancer. And from that data, from the analysis of that data, they come out with guidelines. So I'd like to just kind of read off these guidelines from the American Institute of Cancer Research. Now, the American Institute of Cancer Research is actually a subsidiary of the World Cancer Research Fund. Okay, so this organization also even works on a global scale. So what they recommend, this is the most recent guidelines, which came out, I believe it was 2014. So number one, be as lean as possible without becoming underweight. Number two, be physically active for at least 30 minutes every day. Limit sedentary habits. Don't sit on your butt. Number 3, avoid sugary drinks, limit consumption of energy-dense foods. Number 4, eat more of a variety of vegetables, fruits, whole grains, legumes, such as beans. Number 5, limit consumption of red meats. They actually go so far. This is quite interesting because this is a very reputable, organization that's very, highly funded, highly respected. They actually go on to say in their guidelines to limit consumption of red meats to 500 grams a day. And they go further to say that you should absolutely avoid processed meats. What are processed meats? So processed meats would be things like sausage, lunch meats, bologna, ham, bacon, all these things that we consume pretty readily in American culture. They actually say you should avoid that, based on the scientific evidence that they've collated and reviewed and analyzed. If consumed at all, you should limit alcoholic beverages, 2 for men and 1 for women. You should limit consumption of salty foods and foods processed with salt. You should not use supplements that protect against cancer. Okay, there's some studies that suggest that high levels of antioxidants can actually promote cancer growth. It's best for mothers to breastfeed exclusively up to 6 months, then add other liquids or foods because of the protective effect of breast cancer on some of these hormonally related cancers. And then after treatment, cancer survivors should follow the recommendations for cancer prevention. Now, I want my patients to strive for perfection, but if they're not able to completely, a lot of these are very drastic types of changes for most people. So we allow them a little bit of wiggle room. Okay, so we want to sometimes it's easier for people to kind of make small steps or small adjustments, for example, to their lifestyle than to kind of jump all in, because then many times they're not able to adhere. So we encourage people, instead of drinking the sugary drink, at dinner or during lunch, to drink water instead. Start each meal with a soup or salad or fruit, so they're not overdoing it on the entree. Make one half of their plate green foods, or fruits, vegetables, or non-starchy vegetables. And the second half yellow foods. So then you can have your starchy vegetables, legumes, and/or intact whole grains. And then instead of having that chocolate cake for dessert, have a nice piece of fruit. So we want to aim for meals that are made up of at least 2/3 or more vegetables, fruits, whole grains, or beans, and 1/3 or less of animal protein. Okay. If you're unable to switch to a completely plant-based diet, which many people are, I mean, it's challenging. There's a lot of factors to consider there. There are social factors, there are familial factors, there are cultural factors. Realizing that that's a challenge, to ask people to go completely, plant-based. But what we think would be more doable for most people would be to divide their plate, as you see here, the New American plate, 2/3 whole plant-based foods, and then 1/3 your animal-based, or and making it a lean animal protein, such as a white meat chicken or a fish. People ask me all the time, well, what about protein? Protein. Number one, the amount of protein that most people, consume in the American society is way beyond what we actually need. Okay, and you look at this, it's kind of funny. If you look about examples in nature, such as gorillas and elephants and other large animals that are completely 100% plant-based, you realize that you really don't not need to be consuming so much animal-based protein, and that you can actually get all the protein you need from a 100% plant-based diet. We need protein to repair muscles, bones, skin, and blood. It helps regulate hormones and enzymes. We need protein to help fight infection, heal wounds. The proteins are made up of amino acids. There are 20 essential amino acids. 9 of them need to come from our diet. We're not able to make them. It was once previously believed that you couldn't get these 9 essential amino acids that we need from our diet. You could not get them from plant-based foods. We now know that not to be true. You can get all of the essential amino acids from eating a variety of grains, legumes, vegetables. You can get them all from a plant-based diet. Actually, 10 to 15% of your daily calories should come from protein, and this requirement will vary based on your activity level, body weight, and the amount of stress that you have. Certainly if you're losing weight, you're underweight or malnourished, protein requirements will obviously go up. Okay, and you should definitely consult with your physician before drastically changing your diet. The recommended daily allowance of protein for sedentary adults, for adults who are not active, is actually 0.8 grams per kilogram of body weight. So the average need in grams is body weight in pounds. You can, by using this formula, you can figure out the amount of protein you need, body weight in pounds times 0.36. So a typical example would be a person who weighs 150 pounds. Let's say they have, they're sedentary. You can see here on the slide that they're able to get all the protein they need, just from a plant-based diet, that it is actually possible. What to eat? Again, whole plant-based foods, beans, legumes, fruits, vegetables, whole grains. Whole grains would mean quinoa, oats, wheat, berry, amaranth. Wheat berry, amaranth, barley, buckwheat, brown rice. Grains that are minimally processed, okay, or preferably, not processed at all. Again, I just want to stress you should definitely check with your doctor before you change your diet, especially if you have chronic kidney disease or diabetes, or if you take blood thinners. You should check for drug and food interactions. You can ask your pharmacist or your nutritionist or your physician. And you should consider working with a nutritionist who promotes a plant-centric diet. And we do have folks like that available where I am currently on faculty at NYU. Definitely want to check with your physician or pharmacist for drug food interactions. Particularly a more common one would be Coumadin. You have to be very careful if you're on Coumadin. Coumadin will interact with foods that are rich in vitamin K. Kale, spinach, Brussels sprouts, parsley, collard greens, mustard greens, chard, and green tea. These will all affect your Coumadin levels, so be very careful if you are on this drug. Some resources for further explanation. A great book that I recommend a lot to my patients is written by an MD, Michael Greger. And it's kind of a funny title. It's called How Not to Die. All about the role of nutrition, describes all the evidence that's out there on the role of nutrition for a variety of different diseases. Various cancers are covered in the book. Certainly the blue zones, as I mentioned before, China study written by Colin Campbell. And these websites that you see here, pcrm.org, ACLM, lifestylemedicine.org. And a great documentary film that I usually recommend to a lot of my patients is a film called Forks Over Knives. It came out, I'd say, maybe 6 or 7 years ago. Highly recommend this film. It'll educate you on why it's important to eat, lower on the food chain. And then a great resource for cooking, plant-based meals would be the Cancer Survivor's Guide, written by Neal Barnard. Now, I do believe that you can actually get this for free from the Physicians Committee for Responsible Medicine, pcrm.org. I think you could download it for free in PDF format. Describes, how to eat a healthy whole food plant-based diet, and also gives a lot of very easy to follow recipes. And there's actually DVDs that you can purchase that accompany the book that give you cooking demonstrations. Now let's move on to physical activity, the second most important factor that I consider in the lifestyle medicine prescription. So we know that exercise has been shown to improve quality of life in cancer survivors, improves physical function following rehabilitation. It's associated with decreased fatigue levels in cancer patients. We see increased physical activity after cancer diagnosis, reducing risk of recurrence and mortality overall. Again, we have robust data that supports this. Why would this occur? Well, we know that exercise, first and foremost, potentially to reduce body fat being associated with many different cancers and cancer mortality. It lowers levels of insulin and insulin resistance. It lowers the levels of sex hormones, and some of these sex hormones driving various sex hormone dependent cancers. It lowers levels of the IGF-1, as I described before, IGF-1 being involved in cancer propagation. It lowers the levels of adipokines and other mediators involved with obesity. And of course, it also lowers inflammation. We know that the most common forms of impairment in the cancer population are one being a decreased overall maximal oxygen uptake, or decreased VO2 max. We see this as a widespread issue in most cancer patients or survivors. This, unfortunately, becomes worse as patients undergo their treatments, their chemotherapy and their radiation. Their ability actually to deliver oxygen to their tissues actually goes down. And exercise does what? It makes the VO2 max go up. We see muscle wasting followed by a loss of strength. Affects about half of cancer survivors. Obviously, we see fatigue is very widespread in the population, and we received overall decreased level of functioning. And exercise can help with all these factors and improves all these variables across the board. We have strong evidence that shows that exercise, physical activity, can actually decrease the development of, actually is protective against bladder, colon, breast, endometrial, esophageal, gastric, and renal cancers. There's moderate evidence that suggests that exercise is protective for lung cancer. There's no effect for some of the other cancers like thyroid and rectal. We know that sitting around on the sofa may actually contribute to increased endometrial, colon, and lung cancer. There's moderate evidence that shows that. So what should be our goals for physical activity? Well, the goals for cancer patients or survivors should be the same as healthy adults. The goals, not saying that all cancer patients or survivors are able to do what's recommended, but the goals should be as follows. First and foremost, you should avoid inactivity. You should not be sitting around. We advise that patients do aerobic activity, moderate aerobic activity for at least 150 minutes a week. Okay, so that could be 5, 3, 30-minute sessions a week. Now, moderate, what does moderate mean? The way I like to explain it is using the talk test. Moderate means that you should get winded enough where you're not able to sing a song, but you can still speak. You can still have a conversation. That would be a moderate level. You want to be at that level. What I tell my patients is 30 minutes, 5 days a week, or 150 minutes total for the week. Now, if you were exercising at a higher level, you could do vigorous exercise and you need less time. You only need 75 minutes of vigorous activity. Vigorous meaning that you wouldn't be able to sing and you wouldn't be able to talk. You wouldn't be able to get a word out. You would only need 75 minutes of vigorous activity per week. That's aerobic, like cardiovascular exercise. Now you can combine the two. You can combine moderate and vigorous together. Do you have to do 30 minutes, for example, every day at a time? No, you can break it up. You can do 15 minutes in the morning, 15 minutes in the evening. You can spread it out. We just recommend that you do at least 10 minutes of sustained aerobic exercise at a time. Okay. The more aerobic activity that you do, the more benefits you get. It's a linear relationship. Okay, and there's really no essentially limit on how much you can do, barring complete exhaustion. So doing more exercise will lead to even greater health benefits of aerobic activity. We want you to combine the aerobic exercise with strengthening. Okay, so we want you to do strength training exercise. Now that could be with weights, that could be with just doing anti-gravity or body weight resistance. That could be doing things like Pilates. It could be doing things like yoga, which has a lot of strengthening component to it. We want you to be doing strengthening exercises where you're training every muscle group in the body. We want you to do that at least twice a week. So exercise, we know, stimulates many pathways affecting multiple organ systems, has direct effects on muscle, reduces visceral fat and tissue, and improves glucose metabolism, reduces inflammation, it increases load bearing, and then thereby increases bone density. You actually need your bones need to be subjected to some amount of stress in order to have healthy bone architecture, increases blood flow, increases various brain neurotransmitters. We even see people with cognitive decline or chemo brain. We see that exercise to be very beneficial in that population. Now, there are risks associated with exercise, right? Mainly being the cardiac. So it's important that if you're not an exerciser, you've never exercised, particularly if you're not exercising, you should get an exercise screening. You should see your primary care doctor or your cardiologist and get screened for risk factors before starting an exercise program. You should really only do it under the supervision of a trained professional. Have your physician clear you first for exercise. So if you're not used to it, vigorous activity can be dangerous. You want to start low and go slow. Don't just jump into an intense exercise program. Always start low and go slow. What I mentioned before is the guidelines is the goal. You don't have to start with those guidelines. You can start doing, 5 minutes, a day and build up from there. Gradual progression of exercise over time, frequency and intensity is recommended for the best adherence. If you just jump into something, for example, and you're really sore the next day, you're probably not going to go back to it again, right? So start low and go slow. To avoid musculoskeletal injury, you definitely want to make sure you do a warm-up, and you want to warm up and you want to stretch, but you never want to stretch cold muscles, so make sure you warm up first and then stretch. Start low, increase gradually, cool down, and then again, you want to make sure that you are stretching those muscles after you exercise. I'm going to end there and answer any questions that you might have. Thank you very, very much for your attention. It's been an honor to be here with you today.
Thank you, Dr. Sokolof. We have a couple of questions. So the first question that we have is what can help with neuropathic pain and numbness?
Sorry, can you repeat the question again?
Yes, of course.
Yeah.
What can help with the neuropathy, pain, and numbness?
So there neuropathic pain that results from chemotherapy specifically, or because you can get neuropathic pain. Yeah, from chemotherapy. Okay, so chemotherapy-induced neuropathy, which can be painful, but sometimes it's not painful, where you get the so-called negative symptoms, or which is numbness or tingling, so without pain. For the pain component, there are various medications that are often used that do have minimal side effects. One, for example, is a medication called gabapentin. Another one would be pregabalin. Another one is amitriptyline. One that's been studied where there's some positive data it's called duloxetine or Cymbalta. So there are a variety of different medications that can be used to control symptoms of peripheral chemotherapy-induced peripheral neuropathy. Unfortunately, for the negative symptoms, numbness, tingling, the non-painful symptoms, we don't have a whole lot to combat it. There are some topical agents for painful symptoms, such as capsaicin cream. There are compounding agents. There are pharmacies that can actually make topical, for example, they could take gabapentin, they could take lidocaine, and they can kind of compound it into a cream to treat the pain, so there's minimal absorption systemically into the bloodstream. That's another option. There also are integrative therapies that I have found to be helpful for chemotherapy-induced peripheral neuropathy. Acupuncture being, number one on my list. I refer a lot of my patients for acupuncture. One word of caution: acupuncture is, it's not the same across the boards. There's a lot of variability. There are a lot of differences in techniques. Of course, there's a lot of variability in practitioners. So it's really kind of finding the right practitioner for you. Those are amongst the more common things that I think for neuropathy that I typically recommend. There are now a lot of centers, as folks are going through chemotherapy, they're using cryotherapy. Like, for example, in breast cancer, there's been some studies on the use of ice gloves and socks as patients are getting their infusions, and they're finding that patients are able to tolerate the cold hands and feet while they're undergoing these treatments, and they're finding a significant reduction in chemotherapy-induced peripheral polyneuropathy in folks who undergo the cryotherapy. So, if you're about to undergo chemotherapy, or that's somewhere in the plan for you, you might want to ask your oncologist about getting cryotherapy during your infusions. Next question.
That's great. Yes, we have another question. What are the best ways to lessen long-term side effects?
The best ways to lessen long-term side effects is exactly kind of what I was describing before, is really optimizing your lifestyle. If you're overweight, really trying to lose the weight. Increase your physical activity to really meet those guidelines and even go beyond them if you can. Adhere to a healthy, optimal nutrition plan, and that's a diet that's, again, lower on the food chain, that consists of a lot of mostly whole plant-based foods. Trying to minimize your stress in some way, whether that's through mindfulness or meditation or through yoga. And of course, keeping a very close support network. If you don't have that available to you, joining a support group or finding some other social connection, whether it may be volunteering or just, connecting with other people. Those factors, I think, will help tremendously to help minimize long-term effects.
Great.
And of course,
And this one's a little bit repetitive, but again, what are ways to handle permanent hand and foot neuropathy in order to improve balance and overcome pain? Which I think you could have already answered, unless you want to add something else to it.
yeah, I just would add that, if you're really, if it's really been long term, is that you're definitely making sure that you've been evaluated by a physiatrist, such as, what I do, physical medicine rehabilitation specialist, preferably somebody who has an area of interest or experience with cancer, but doesn't have to be necessarily. Perhaps also a neurologist. If you have long-term neuropathy, make sure that you've had an appropriate diagnostic workup, because sometimes there can be reversible forms of neuropathy that may have gotten overlooked. That, for example, there could have been some already underlying factors that were going on, and then you had chemotherapy, developed neuropathy, but because you may have had a susceptibility for whatever reason to the neuropathy, your symptoms are lasting longer. So you just want to make sure you get an extensive workup and make sure there's nothing there that could be reversible. A variety of different things can cause neuropathy, not just chemotherapy, so you just want to make sure you rule those out.
Great answer. Another one here is, should you continue with your usual exercise during your chemo infusion treatments or reduce them?
We do recommend that. We do recommend that people
Yes.
do stay active through the treatments. Now, does that mean if you're completely, fatigued and you really, you don't have to force yourself? We certainly don't want people exercising to the point of exhaustion. We don't want that. But if you're able to exercise, yes, we do want you to do that. Now, if you're sort of like a CrossFitter or something like that, you're doing a lot of really, intense, vigorous exercise, initially you might want to scale down, depending on how your treatments are affecting you. You might want to just tone it down a little bit, but it's certainly reasonable. I have, several examples of patients that have exercised even vigorously through their treatments and have done very well. So it is possible, but you want to sort of alter your regimen to how you feel, but certainly do not stop moving. Do not stop exercising. Try to be active even throughout your treatment.
Great. One more question. How can I prevent more side effects from developing, like lymphedema?
So again, I keep going back to the same concepts, but we do have very robust data. This was published by Dr. Katie Schmitz in the New England Journal of Medicine several years ago, that we know that exercise, particularly strength training or resistance training, is protective against lymphedema. Okay, so again, lifestyle, maintaining a healthy body weight, staying active, eating to promote, to counteract inflammation. So again, eating a diet that is mainly a whole food plant-based diet. It doesn't have a lot of processed foods, sugar, and fatty animal foods. Those types of factors will hopefully minimize the development of these late effects, especially lymphedema.
Great. So we have tons of more questions, but we're going to have the last one because we only have 2 more minutes.
Okay.
And here is, there's someone that has very low energy. She says, will I ever gain energy? I sleep an average of 10 hours a day. What can I do to get my strength and stamina back?
I feel like I'm repeating myself, but I'm just gonna go back to the best treatments that we have. The best treatment, it's so ironic, the best treatment that we have for cancer-related fatigue, you guessed it, exercise. I know it's hard when you're feeling so fatigued and you're sleeping so long, that you would want to do any type of physical activity. But studies have shown that the more active you are, the less fatigue you actually will have. Now, if you are sleeping that long, you're still finding that you don't feel well rested when you wake up and you're feeling fatigued, you should make sure that you should have maybe a sleep evaluation. Make sure that your sleep is optimized. Do you wake up, for example, throughout the night? Do you have sleep apnea? There are other factors that may be disrupting your sleep patterns and why you're not getting enough sleep and why you might be fatigued. But again, the number one gold standard treatment for cancer fatigue is exercise. We have no better treatment for it. And it is a good treatment.
Right, and it's free.
Well, thank you very much.
Yes, well, thank you so much. I would like to thank Dr. Jonas Sokolof for an informative program, and thank you all for participating and submitting your questions. Please take a moment to fill out the survey at the end of the webinar. It's very important. It helps us create more content for you guys. Thank you, Dr. Sokolof. We really appreciate all your information, and we'll hope to see you guys in the next webinar. Have a lovely day.
Sounds good. Thank you very much.